and welcome to How to Gastro. In today's video, we're going to be talking about a very common and interesting topic, and that is the pink eye, which is also commonly known as conjunctivitis. So let's get started. So what is pink eye? Pink eye, which is also commonly known as conjunctivitis, is the inflammation or infection of the transparent membrane, which is called the conjunctiva, that lines the eyelid and covers the white part of the eyeball. When small blood vessels in the conjunctiva become inflamed, they're more visible. This is what causes the whites of the eye to appear reddish or pink. Pink eye is commonly caused by a bacterial or viral infection or an allergic reaction, and is a very common pathology in children. So from this definition of conjunctivitis, we get that it's actually the inflammatory process of the conjunctiva of the eye. So as our little doctor here is telling us, the conjunctiva is a tissue that lines the inside of the eyelids and covers the entire sclera, which is the white of the eye. So the conjunctiva is actually this transparent cover, which actually lines the underneath of these eyelids and actually covers the entire white portion of the eye, which is the sclera. So it's actually just a plain see-through transparent membrane, which can become inflamed. And that's because it has blood vessels in it, which when they become inflamed, they become more visible and get sort of this pinkish, reddish color. So pink eye is a very common disease in children, and there can actually be three types of pink eye. So we can have a bacterial pink eye, a viral pink eye, or an allergic pink eye. But we'll explore those topics further as we go along in this video. So now that we know what the basics of pink eye is, let's take a closer look at what can actually cause the pink eye. So as I mentioned in the slide before, there are three main causes of conjunctivitis or the pink eye. So the first and most common is viral conjunctivitis or viral pink eye, and then we can have bacterial conjunctivitis or bacterial pink eye, and then we have lastly the allergic conjunctivitis or the allergic pink eye. So this is what a classic look of the viral conjunctivitis is, and the viral conjunctivitis is the most common type of pink eye. And this conjunctivitis is very contagious and often spreads through schools and other crowded places. It usually causes burning, red eyes with a watery discharge. So the classic manifestation of the viral conjunctivitis is the redness, but a clear discharge. And we'll see it's very different from bacterial conjunctivitis in that way, because bacterial conjunctivitis has a more cloudy, pussy discharge. Anyway, coming back to this viral conjunctivitis, so the adenoviruses are most commonly responsible for this infection. And other viruses that can cause the viral pink eye include the herpes simplex virus, varicella zoster virus, the pox virus, the picornaviruses, and the human immunodeficiency viruses. So these are all causative agents that can be the pathogenic agent in the viral conjunctivitis. So now let's move on to the bacterial conjunctivitis. So the bacterial conjunctivitis is also very contagious, and an infection from a bacteria causes this form of pink eye. So with bacterial conjunctivitis, you have sore red eyes with a lot of sticky pus. And staphylococci and streptococci are the types of bacteria that most commonly cause bacterial pink eye, but gonococci and chlamydia may also cause bacterial pink eyes, and these are common STD agents. So these can all be the causative organisms in the bacterial conjunctivitis. And finally, let's talk a little more about the allergic conjunctivitis. So the allergic conjunctivitis is a type of pink eye that comes from an allergic reaction to something. And therefore, it is not actually contagious because it actually depends on the specific individual and what they are sensitive to. So the allergic pink eye makes your eyes very itchy, red and watery, and the eyelids may get puffy. So this is the classic allergic reaction. And the allergic conjunctivitis can be caused by eye irritants such as pollen, dust, and animal dander among susceptible individuals. An allergic conjunctivitis may be seasonal in cases when pollen are the causative agents, or flare up all year round in cases when dust or pet dander are the causative agents. So as we can see, the causes of conjunctivitis or the pink eye are vast, depending on whether the agent is viral, bacterial, or even allergic in some cases. So is conjunctivitis contagious? So the pink eye that is caused by bacteria or viruses, so viral pink eye or bacterial pink eye, can spread to others as soon as symptoms appear and for as long as there is discharge from the eye. So viral conjunctivitis often begins in one eye and then infects the other eye within a few days. And a child can get pink eye by touching an infected person or something an infected person has touched, such as a used tissue. So in the summertime, pink eye can spread when kids swim in contaminated water or share contaminated towels. It can also be spread through coughing and sneezing. So as we can see, the bacterial and viral conjunctivitis are the both forms of contagious conjunctivitis, and they spread very easily, especially in kindergartens or schools where we have children that are interacting very closely. So in addition to the infection spreading from one eye to the other in one infected individual, it can also be spread to several other individuals who come into contact with this infected person, or even touch some of the objects that the infected person may have touched, such as toys or tissues or towels or anything that may actually spread the bacterial or viral particles between them. So yes, viral and bacterial conjunctivitis is extremely contagious, but of course the allergic conjunctivitis isn't, because it depends on the individual's specific susceptibility to irritants such as dust, pet dander, or pollen. So now let's talk about some general signs and symptoms in conjunctivitis. So the first thing is the feeling that something is in the eye or a gritty sensation in the eye, red eyes, burning eyes, itchy eyes, painful eyes, and this is usually with the bacterial form, watery eyes, puffy eyelids, blurry or hazy vision, being extra sensitive to light, and lots of mucus, pus, or a thick yellow discharge from the eye, and they can be so much that the eyelashes actually stick together, and this is usually seen with bacterial conjunctivitis. So as we can see in this image down at the bottom of our screen here, we see what the classic bacterial conjunctivitis is. It oozes out so much of pus and discharge that the eyelashes actually can begin to stick together. And finally, let's talk about the treatment of pink eye. So in viral pink eye or viral conjunctivitis, here most of the cases are mild and the infection will clear up in 7 to 14 days without any treatment. However, viral conjunctivitis that is caused by the herpes simplex virus or the varicella zoster virus can be treated by specific antiviral medications. So these are antiviral drops which can be prescribed for these patients. In bacterial conjunctivitis, here an antibiotic is usually given topically as eye drops or ointments which are administered and applied over the eye. And the antibiotics will help shorten the length of the infection, reduce complications, and also reduce the spread of the infection to others. And lastly, the allergic conjunctivitis. So here the conjunctivitis is mainly caused by an allergen such as pollen or animal dander, and usually improves by removing the allergen from the person's environment. So allergy medications and certain types of eye drops such as topical antihistamine or vasoconstrictors, including some prescription eye drops, can also provide some relief from the allergic conjunctivitis. And that brings us to the end of this video on the pink eye or conjunctivitis. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you'd like to download a copy of this presentation, you may do so by clicking the link in the description. Take care and bye for now.